State and local governments are racing to increase capacity to test for COVID-19, and your local pharmacy could play a big role in making that happen. This morning, Kathleen Jaeger, a pharmacist and senior vice president at the National Association of Chain Drugstores, joins us live via satellite to talk about what pharmacists are doing. Good morning.
Good morning, Suzanne.
Kathleen, what are pharmacists doing when it comes to COVID-19 testing?
Well, there's action by the Trump administration last week that actually is providing guidance across the United States, allowing pharmacists to order and test for COVID-19. And that action is a real big game changer. And what we're looking for is an additional action to be done, and that actually is at the governor's level, looking for the governors to remove the remaining barriers for testing and really to be able to take that testing to the next level so that we can scale it for all the communities.
And what have you heard about pharmacists seeing and hearing from the front lines of the crisis? I'm sure they're busier than ever.
You know, what's extraordinary is really the admiration and dedication that we're seeing from the communities. They're putting well wishes and thank you notes and even some beautiful chalk drawings out there. And really, everyone has been phenomenal. And of course, the pharmacists are right there. They're first responders. They're unsung heroes. Everyone in the pharmacy, from the team members, from the clerks to the front store, everyone is doing a fantastic job and everyone's very dedicated.
And they already deal with people who might be dealing with sickness and, of course, concerns over COVID-19. So how are drugstores and pharmacies adapting to the crisis?
Well, actually they're all adapting, and they're actually adapting quite well. They're actually following CDC guidelines and in protocols to make sure that everyone is safe. So as everyone can imagine, safety is paramount. So we're ensuring the employees and the customers that are coming into the pharmacy are safe, and we're actually engaging in social distancing. At the same time, pharmacists are trying to ensure that everyone, every patient has the medication they need. So all the essential medications, if they are seeing a spot shortage or an actual shortage, they're getting the medication that they need to maintain their health and stability.
Do you have any advice when people go to the pharmacy now? Has any protocol changed, especially if they're trying to get a test?
So if they're trying to get a test, what I would suggest is, one, have some patience. As I mentioned, we need the governors to issue, to remove these remaining barriers. At the same time, we need to ensure that we have that supply. So patience is going to be critical here. And then what we also need everyone to do is actually reach out to their local community pharmacy and look at their website and see where the testing will be held. It will be held outside in the mobile testing facilities or through drive-thrus. And so we want to make sure, though, those patients that think they need the testing or feel like they are sick, that they don't come into the pharmacies. And for those that are very well, but actually need their medications or need new medications, we're asking them to, work with their doctors and send in electronic prescriptions so that their pharmacists can get those ready for them. And so when the patient comes in, the medication is ready.
And what can state governments and on the federal level and also just people do to support pharmacists who are frontline workers at this time?
To support the workers, everyone, again, we need to make sure that all the workers across the country are safe, and everyone needs to comply with CDC guidelines and OSHA requirements and the like, and everyone is doing that. And everyone needs to make sure we really do maintain social distancing.
Thank you so much. Kathleen Jaeger with the National Association of Chain Drugstores. Thank you so much for joining us.